Hi everyone and welcome back to my channel. Thank you so much for coming back. I'm so delighted to have you back with me. So today I'm going to be talking about what I deem to be as totally unacceptable. We're talking about topical steroid withdrawal. So topical steroid withdrawal and topical steroid addiction is a dependency on topical steroids that are prescribed for you for something such as eczema. Now, these both remain unrecognised by the NHS. Although these have been prescribed by the NHS, the knock-on effect of overprescription and overuse of them remains unrecognised by them as a condition. Although in some cases the short-term effect for some may be appropriate, it is very common for topical steroids to be used for a long time. This is not a long-term solution to a lot of eczema, contact dermatitis and allergic dermatitis solutions. I'm going to say now that I am not a medical professional, I am not a dermatologist. This is coming from somebody that has been through it. I have used topical steroids for years. I have seen people who have used them for a few months and the effect lasting a long time. I have been prescribed these since I was 17 years old and I have used them since then. I am now 25, so I have used these almost every day for a long time. I will insert a picture of the results of using these. Although in the short term, yes, you look a lot better, your eczema goes down, that's great. However, once you stop using them, here's an example of what happens to you. In this video, I'm going to explain a bit more about the condition and why there is a need for this to be recognised by the medical community, by dermatologists and by the public as a whole in order to stop this happening to other people and indeed people as young as babies. So if you're interested in this video and to learn a bit more about this issue and what you can do as a result in order to help others and to prevent others from going through the same thing, I would love it if you would like and subscribe. Let me know in the comments down below what you think of this video. Let me know if you have any comments to make, any opinions or anything that you would like to share with the community. Please comment down below. Please follow me on Instagram. Feel free to message me there about this topic and let me know what you think about it. So without further ado, please keep watching. So how does this all start? This stems from a skin issue. So many people have eczema or eczema, they have contact dermatitis or allergic dermatitis. They may also have something like psoriasis or acne. Some form of skin issue makes somebody go to the doctor. Without the fault of the doctor, they want to prescribe you something that will help in the immediate effect so that you feel better and that you can leave knowing that something is being done. For some people, this may work fine and their condition may get better and they have a great improvement, and that's great. But for a lot of people, once they come off of those medications, their skin then worsens. They then go back to the doctor and ask for something. They may not see the same medical professional, and so we may not catch it then. Someone else may prescribe these, so that may be a cream or an orally taken tablet. I have taken both for many years. These steroids then act as an anti-inflammatory, so they take down the skin appearance. They also reduce inflammation. I have had a lot of problems with swelling, so this will help greatly in the immediate effect. As soon as I take these, I start to deflate. The knock-on effect of that is then when I stop taking them, I go back up again. The skin goes red again. The itching starts, the weeping starts. The problem is then, the patient then goes back to the medical professional. And unless we get to the root cause, then they will be prescribed something very similar. And if you're unaware or you're unsure of what to do, you may be prescribed these for a child, for example. And this overprescription and the then result as an overuse, resulting in an overdependence on these steroids, means that the body then thinks that this is what the norm is and stops producing its skin turnover properly. Patients and then medical professionals are then, as a result, left feeling really unsupported and confused. So the medical professional may then decide to refer you to other places in order to help you, because they may not understand. However, there are plenty of disclaimers about the overuse of steroids. However, when you're in the moment, you want to do anything to help make the situation better, either as a patient or as a carer of the patient. Therefore, the whole dialogue around this issue is very confused and people don't really know what to do. So what do? You try and get something to make it better, even in the short term. So how do you know what this is whilst you're using them? How do you identify that you're starting to become addicted to these steroids? So whilst you're using them, you may have a red rash, you may have intense itching and a sort of burning feeling, whether that be on the actual area that you're using the steroids on or not. I never particularly used steroids on my arms. I always used them on my face. This then caused massive chain reactions in other places on my body. The body is one big system. The skin is the biggest organ that you have. So just because you absorb something on your forehead doesn't mean it won't affect your feet. So with that in mind, if you're taking something and you're only using it on your arms, common place for people to get eczema, don't be surprised if you then get it on your back, or on your legs, or somewhere else, because it's one big system. A common way to notice if your body is then becoming dependent is that these creams or these tablets are then becoming unable to control the itching or control the rash or control the spread. So you then have to start using them more. Although there are plenty of disclaimers saying use only sparingly or thinly once per day, you then go back to the doctor and they say try using it twice a day, and this keeps going on and on. So once again, as I said, you then start to become stuck in a cycle and the body starts to become more and more dependent. You get more red, you get more outbreaks, they become more frequent, the rash gets worse, the burning gets worse, you don't know what to do. And obviously these steroids will make it go down in the interim, but you can't see why this is making it worse. The result is, once you then start to come away from them, you have what is called topical steroid withdrawals. This is what I talk about a lot on my channel, as this is something that I have gone through myself, and I am still going through, as you can tell. This includes extreme skin shedding, which can as a result mean that you have hair loss, obviously including your eyebrows and your hair. I have gone through that myself. Oozing, very, very painful, burning, yellow, infected looking skin that starts to ooze like resin. You then also have massive red sores. You also have scabbing from itching, which also can get infected. You also then, as a result, have unbelievable nerve pain. You also can have a lot of insomnia, things such as your system interior. You become unable to digest food properly. You can feel very sick, very faint, and it is not a great feeling. So this becomes completely insufferable for the person and for those around you. It is completely unnecessary stress caused on the body and caused, more importantly, on the mind as a result of something which is prescribed for you. This also happens to babies, and I think it is totally inexcusable for this to be happening to babies. This is completely preventable. Yes, it is completely preventable from a medical side and from the person's own due diligence. There is an onus on the person to not overuse these steroids, as there are plenty of warnings about the overuse of them. However, it is so important for the medical community when somebody comes back to see a doctor for some help that they are able to recognise this and to help the person who is not in the know. It's important for the person to do their own research. Yes, it is important for the person to do their own due diligence, and yes, it is important to listen to the advice of medical professionals and dermatologists. However, it is also important that the medical community and the dermatological community are so adequately supported and have the advice of people that have been through this in order to make sure that other people, and especially infants, are not going to go through this anymore. We need to make sure that we're getting to the root source of the problem and not actually making it worse. So what is it that you can do? I will put a link down below to a fantastic campaign called the Scratch That campaign. This is a group of girls who have decided to band together and crowdfund a website where there will be case studies, there will be information, there will be a hub of community support and guidance for those going through this in order to do something about it from within the community, so that if you are going to the doctors and this isn't working, we as a community can help each other. I think as well, if you are a carer or you know somebody that is going through this, I think this would be a great signpost for them to go and see where there are more people who are going through something similar. I'll put some links down below to other sources of information where you can read up on this condition yourself. Not only does this debilitating condition rob people of precious time in their lives because they go completely inward, they become more insecure, they become fragile in a lesser form of their former self, and it is totally avoidable. And this is why I decided to make this video. As a result, this wastes really precious NHS time as patients go back lamenting their skin woes to doctors, dermatologists and nurses who at this time really need what valuable time that they have to treat those most in need. The truth is that many people are repeatedly prescribed medication which depletes their mental health, their body, their skin, and most importantly, their happiness. In my opinion, it is absolutely inexcusable for this to continue, and at a time when we can feel so lonely and insecure and uncertain in a time full of information overload, I think we should really join together and collectively share our sources of information in order to make a better situation out of this. Make sure that you decide to support something such as the Scratch That campaign. I am part of the campaign myself. I just think that it's a fantastic thing to do in order to have more accurate information available to those in need, in order to free up valuable NHS time which is needed for those who are in much more dire straits than we are, and we shouldn't be using that precious time for something that is completely avoidable. We need to make sure that we're doing as much as possible to help the precious NHS and help to alleviate the burden of a preventable condition. Look into the Scratch That campaign and make sure that you consider signing up to it, as topical steroid addiction and topical steroid withdrawal are completely preventable. By allowing more information to be shared, it means that less people will go through this too. So there you are, guys. Thank you so much for watching. Please like this video if you enjoyed it. Comment down below if you have any further opinions or any other comments to make. Make sure that you subscribe to my channel and share this video where possible in order to make sure that people recognise topical steroid withdrawal in the public domain, and make sure that you're looking after yourself. Thank you so much for watching. Bye.